In this video, you're going to learn the differences between dyslexia therapy and tutoring. My name is Megan Pinchbeck, and I am the owner of Dyslexia On Demand, the premier provider of web-based one-on-one dyslexia therapy. Today, I'd like to explain the difference between dyslexia therapy and dyslexia tutoring, because there is a difference. When researching online dyslexia support options, it helps to understand how the services differ in order to find the best fit for your family. With any investment of time and money, outcome is the closest measure of success, and language intervention is no exception. So one may ask themselves, does it matter if I do dyslexia therapy or dyslexia tutoring? And the answer is yes. Dyslexia tutoring is the most common offering for dyslexia and can take on many shapes and forms. Tutoring is a generic term that can range from access to prescriptive computer programs, which support a student's phonetic enrichment in both spelling and reading, to working with a teacher one-on-one on a specific deficit area. Dyslexia tutoring is offered generally at a lower frequency per week and can be administered by a certified classroom teacher or a special education generalist. Tutoring is typically based on an academic need and is great as a review for previously taught concepts. Dyslexia tutoring generally lacks the layering and complexity that the dyslexic brain needs and does not venture deeper than surface-level curriculum. Additionally, the term Orton-Gillingham does not specify therapy, but instead a methodology and approach to dyslexia intervention. While an Orton-Gillingham tutoring approach may be the most beneficial with working with students with dyslexia, it's important to know that the term alone does not imply proper dyslexia therapy. Although many such programs exist, such as Barton and Wilson, one does not need to be a licensed dyslexia therapist or a certified academic language therapist to implement these programs. A simple training course can be attended by parents and teachers alike to administer the programs. The concern area is that those leading the program often do not understand the dyslexic brain enough to be prescriptive in action, but instead can only teach to the instructional manual. Dyslexia therapy can only be implemented by a certified academic language therapist or certified Orton-Gillingham therapist. A CALT provides diagnostic, explicit, systematic, multisensory structured language intervention, which builds a high degree of accuracy, knowledge, and independence for students with written language disorders, including dyslexia. A certified academic language therapist, or CALT, will prescriptively guide your child through a multisensory program of explicit, systematic instruction for both reading and spelling. Programs such as Take Flight, developed by the Texas Scottish Rite Hospital for Children, are examples of therapeutic-level Orton-Gillingham techniques. This is evidence-based programming that we use here at Dyslexia On Demand. Whereas we utilize this program with fidelity, we use this as a baseline to individualize to the specific needs of your child. This program is clinically prescriptive and diagnostic, multisensory, intensive, and results-driven. When a student is guided by a CALT through a therapeutic approach such as Take Flight, that therapist is literally rewiring parts of their brain to create new neural pathways to access the written code and become proficient readers. The path to becoming a certified academic language therapist is not for the faint of heart. It requires a master's degree, 2 years of intensive training through an MSLC accredited training facility such as the Scottish Rite, and accruing 700 clinical hours before finally passing their national certification exam through the Academic Language Therapy Association. Sadly, there is a gross underrepresentation in this field, with some of our largest U.S. states only having a handful of certified therapists. Not only are they not present to intervene appropriately with children, they're not present in order to help educate parents, medical clinicians, and public servants making policy and legislative decisions. With time, we hope that the existence of pure dyslexia therapy programs and their partnered dyslexia professionals becomes a regularly understood difference. Luckily, there are virtual options, such as Dyslexia On Demand, offering that caliber of intervention to students regardless of their geographic location. Knowledge is power. When choosing the intervention strategy that is right for you, it is always helpful to understand why one approach is advantageous to another.